So this is a public service announcement on HIV infection being a human rights issue. So how are they linked? Well, UNAIDS said where human rights are not protected, people are more vulnerable to HIV infection. So the HIV pandemic has brought to light the injustices that exist in our societies as a result of the inability to uphold human rights. 25 million people have died from AIDS between 1981 and 2007, and approximately 65 million people have acquired the disease. Every country in the globe has been affected by HIV, and in the hardest hit nations, it is reversing much of the progress that they have made over previous decades. AIDS continues to be the primary infectious cause of young adult mortality in the majority of low-income countries, despite the fact that effective HIV medicine has been available since the 90s and that treatment currently costs less than $100 annually in developing nations. The bulk of medical research only concentrate on the biologic cause of disease, but when seen from a biosocial angle, these biological and clinical processes are best understood in conjunction with an examination of both biological and social qualities as they are impacted by the political economy, history, and culture. So hunger and AIDS. With little systematic research that have been done into how AIDS affects development, despite repeated warnings that it might be disastrous, and hardly any studies that have been done on HIV/AIDS, food security, famine, and nutrition. But according to demographic research, a famine or pandemic might have secondary impacts that are at least as significant as their initial effects. For instance, a chain of additional famines and epidemics or a significant outmigration may result. This reaction starts with the food crisis that is emerging in southern Africa, which is the location of the world's worst AIDS epidemic, with most countries having a prevalence of HIV in adults in excess of 20%. Zambia, Zimbabwe, and Botswana have recorded very high levels for several years, and AIDS mortality rates are climbing steadily. Households affected by AIDS morbidity and mortality lose income, assets, and skills. Those with chronically ill members have average reductions in yearly income of 30 to 35%. Before Zimbabwe reached a catastrophe, one of the few studies on the impact of AIDS on rural cereal output was conducted. The findings revealed that the amount of maize sold by a family decreased by 45% in the event of an adult death, but by 61% in the event that AIDS was the cause of death, pointing to household labor availability and food access being closely related. Famine can be explained on focusing less on the supply of food and more on the ability of the most vulnerable people in the society to produce or purchase it. Famines have occurred in the absence of widespread shortages of food. Findings from research at the household level of affected families show the formation of a new class of impoverished and vulnerable individuals, namely those with HIV and AIDS. When high value and nutrient dense crops such as cereals and oilseeds are replaced by low value, nutrient dense ones like cassava, it is a sign of growing poverty. Cassava production rose from 800,000 metric tons in 1990 to 2 million in 1999 in Malawi, Zambia, and Zimbabwe. So a lot of so a lot of the HIV and AIDS impact can be seen in the household. Due to marital and mother-to-child transmission, HIV and AIDS have its consequences are concentrated at the level of families and communities. A steady reliance ratio can mask significant negative changes for the afflicted families, which could result in their viability being lost. AIDS alters the age and sex distribution of the adult population. For instance, there are more adolescents and persons in their early 20s and fewer mature adults in the population. There are fewer adult women in the population because they often get HIV at an earlier age than males do. Mature individuals, especially women who contribute more to supporting dependents, make up a smaller percentage of the population than young men and youth who play a smaller part in support. Estimates of traditional dependence ratios are predicted on the notion that all people are productive. A small but significant portion of those affected by an outbreak of AIDS are chronically ill, and they should be classified as dependents. So in conclusion, the analysis of HIV infection should take into multiple disciplines and break down the boundaries that separate them. Occupational rank and health may point to social causes, but they may not account for key social processes. The disparity in health outcomes are a result of social and environmental determinants of health, which are deeply ingrained in the social structures of mankind.